Hello dear students, welcome to Dr. SP Nayak MedEasy classes. In today's class, let me tell you some very important expected questions in Gpat examination. So the question on the board is one of the question that appeared in 2019 examination. So let me read out the question. Which of the following directly inhibits factor 10A is the question. So factor 10A is one of the factor in the clotting mechanism. So which of the following drug will directly inhibit factor 10A? So let me read the options for the question. The first option is dabigatran is one of the anticoagulant drug. Option B is warfarin. Option C is bivalirudin, and D is rivaroxaban. So these are four different anticoagulants. Usually these four anticoagulants are having different mechanisms on different clotting factors. Okay, so before solving the question, so let me tell you the classification of anticoagulants. So when any question comes regarding the coagulation or coagulation factors or regarding any anticoagulant, definitely you will do better in the examination. So let me classify anticoagulants. So actually, while classifying the anticoagulants, we have two different classes of anticoagulants. The one is the drugs which are used in the in vitro and the drugs which are used in vivo. So in the labs usually, so we use anticoagulants to stop the clot of the blood. So in labs we use commonly heparin is one of the drug. So heparin is used in vitro and as well as it is also used in vivo. Okay, it is used in human beings as well as in the labs. Okay, heparin. And the next one, the anticoagulants which are used in the labs are sodium edate, sodium citrate, and sodium oxalate. So these are some examples of anticoagulants which are used in the labs for anticoagulation. And let me classify the drugs which are commonly used in the human beings. So in vivo anticoagulants. So the first one is coumarin derivatives. The first class of anticoagulants are coumarin derivatives, and in coumarin derivatives we have warfarin, coumarin, and acinocomarol. Acinocomarol is also called acetrom. So acetrom is very commonly used anticoagulant in the hospitals. Okay, even warfarin, coumarins, and heparin. So these drugs. So the first class of drugs is coumarin derivatives, and the next indandione derivatives. So in indandione derivatives we have phenindione and anisidine. So these are the two examples of indandione derivatives, and the third one we have direct thrombin inhibitors. So direct thrombin inhibitors is dabigatran is one of the example, direct thrombin inhibitors. And the next class we have direct 10A, factor 10A inhibitors. So because factor 10A is very important in clotting mechanism. So I'll explain about the clotting mechanism later. So the drugs which directly inhibit 10A are rivaroxaban, and we have apixaban, edoxaban, and betrixaban. Remember, xaban, Xaban, xabans are the drugs which directly inhibits 10A inhibitors. Here we have xaban. So just remember, 10A inhibitors are xabans. So this is the best mnemonic you can remember if it comes in the examination. And finally we have heparin. Heparin is the common drug which is a anticoagulant. So these are some of the anticoagulants which are very useful in the hospitals. So let me explain the coagulation mechanism. So how the coagulation mechanism occurs in our body. So listen guys, so we have two factors, intrinsic factor and extrinsic factor. So two factors. The two factors will increase the coagulation of the human being. So I'll explain about the extrinsic factor. So extrinsic factor is nothing but any injury occurs to our body or anything, any cut occurs on the skin or anything, extrinsically or external injury of the tissue is called extrinsic factor or extrinsic root of coagulation factor. So extrinsically, when a patient's skin is cut, then the wound or the area of the injury is exposed to the air. So the exposed part of the tissue will try to activate due to extrinsic factor. Actually, the factor 12 is activated to form factor 12A. Due to exposure of the tissue into the air, factor 12 is converted into factor 12A. Okay, so factor 12 is an inactivated form, and factor 12 is called Hedgeman factor. Remember, factor 12 is called Hedgeman factor. Hedgeman factor is converted into factor 12A, which is an activated form, and this factor 12A, it activates factor 11 into 11A. Even factor 11 is an inactivated form, and 12A activates 11 into 11A. And listen guys, this 11A again, it converts or it activates factor 10 into 10A. So factor 11A is converting the inactivated form of factor 10 into 10A. So we have factor 10A. So 10A is activated, and now 10A has a very important mechanism. This 10A tries to activate prothrombin. So prothrombin is activated into thrombin by factor 10A. So prothrombin is very important protein which is helpful for the formation of clots. Okay, so 10A factor is the main agent which activates prothrombin into thrombin. And finally, the activated thrombin converts fibrinogen into fibrin. So thrombin converts fibrinogen into fibrin. So fibrin is the final product of the clot. So fibrins are some of the fibers of the clot which has a high capacity to block the bleeding actually in the tissues, in the open wound. So this fibrin is the final fibrin is the final product of the clot. So this fibrin is formed from thrombin, and where thrombin is activated by factor 10A. So 10A is very important. Okay, so we have some drugs. So the drugs which directly inhibit factor 10A. So the drugs that directly inhibit 10A are Xabans. I previously told you regarding the classification. So Xabans drugs will directly inhibit this factor, and by that it stops activation of prothrombin to thrombin, and further it will stop clot. Okay, so this is the major function. And let us come with the question. So I think you understood the question. Which of the following directly inhibits 10A? So we have dabigatran, warfarin, and bivali group, and we have ribaxaban. So listen here, Xaban. So one of the drug in this option 6, Xaban. So rivaroxaban, here we have rivaroxaban is one of the drug that directly inhibits. So we have rivaroxaban which directly inhibits factor 10A. So this is the correct option. So like that we have to study the questions, and let me tell you some other very important expected questions for further examinations. So you can expect any other question if the regarding the factors and the classification, and if any question which comes regarding the classification, I will tell you about coumarin derivatives. So what may be the mechanism for coumarin derivatives? Remember guys, coumarin derivatives or vitamin K reductase inhibitors. Actually vitamin K reductase is an enzyme which activates the inactivated form of vitamin K into activated form of vitamin K. So Vitamin K reductase is the enzyme which activates inactivated form of vitamin K into activated form of vitamin K, because vitamin K is very very important for the synthesis of all these factors, especially factor 10, almost all the factors. So vitamin K is very very important vitamin for the formation of factors, and by that it is very useful for the synthesis of clot or for the formation of clot. So vitamin K has strong coagulation capacity. So actually vitamin K is used in the patients who has severe bleeding risk, or in the neonates, or the patient who has bleeding disorders. So whenever a patient has severe bleeding, so we inject vitamin K. So vitamin K is strong coagulant, remember. And coumarins are the drugs which antagonizes or which stops the activation of vitamin K. So here coumarin derivatives or vitamin K antagonists. So that is about coumarin derivatives, and remember its mechanism also and examples in coumarin derivatives. And next one, indantine derivatives. Even this is a vitamin K antagonist, so it will act against the vitamin K, and by that it stops the formation of clot. So that is about indantine derivatives. And anyways, we have discussed about direct 10A inhibitors, and the one direct thrombin inhibitors are the drugs. Dabigatran is one of the drug which directly inhibits factor 10A, the factor thrombin. So here we have thrombin. So thrombin is very very important agent which activates fibrinogen into fibrin. So we have a drug that directly inhibits thrombin, so that is dabigatran. So dabigatran is a drug which directly inhibits thrombin. So by the inhibition of this thrombin, there is no activation occurs from fibrinogen to fibrin. So even that will reduce coagulation. So we have direct thrombin inhibitors. And remember guys, that is about the drugs. And the next, let me tell you some points about the factors. Remember, this may come in the further examinations. So factor 1 is called fibrinogen. Factor 2 is called prothrombin. Factor 3 is called tissue thromboplastin, and factor 4 is calcium. And even all these factors will have somewhere role in the formation of the clot. However, I did not explain in detail about the coagulation mechanism, but try to remember all these names of the factors. And factor 5 is called proacylrin, and factor 6 is called acylrin, whereas factor 6 nowadays we call factor 6 as acylrin because previously it was not known. And factor 7 is called procomartin, and factor 8 is called anti-hemophilic globulin, and factor 9 is called Christmas factor. Factor 10 is called Stuart factor. Factor 10 is Stuart factor. Factor 11 is thromboplastin. Factor 12 is Hedgeman factor, and factor 13 is fibrin stabilizing factor. So these are some of the names of factors. So try to memorize all these names because these are very important. So you can expect the questions even from those concepts. So that's it about coagulation, anticoagulants, and coagulation mechanism, and different drugs in the anticoagulants. And if I miss anything, please don't forget to comment, and please follow my lectures. I am preparing a Gpat series. So before going to the Gpat examination, please do watch all my pharmacology related Gpat most expected videos. And if you do watch all these videos, definitely you will do better in pharmacology Gpat examination. And please do share with your friends who are preparing for Gpat and some other competitive exams in pharmacology. And thank you for watching.